Joining us is Dr. Andrew Gonzalez. He's a health services research fellow at the University of Michigan and also a resident physician in general surgery at the University of Illinois Hospital and Health Sciences System. All of his answers today are his personal opinions. And remember, these are not meant to be individual medical advice. Certainly talk to a professional in your area. These are just his general ideas. So, Dr. Gonzalez, we sourced a bunch of questions from the audience. We picked 3 that we'll look at today. The first one is from Lenneth, and he says, I'm curious if Dr. Gonzalez can share long-term adverse reactions resulting from the use of the drug Chantix, which, of course, is a drug that is meant to help people quit smoking. I'm more familiar with kind of the short-term while you're taking it types of side effects. So maybe talk about those first, and then if any are known, the long-term effects.
Absolutely. So as you mentioned, the short-term side effects are significantly more important. The most significant of which is that it can cause mood changes and suicidal ideation. Additionally, the most common side effects are by far nausea, which is reported to be in 30% of patients. Regarding his question as far as long-term side effects, the important thing to consider here is that Chantix is not a medication that's meant to be taken in the long term. The goal is to get you to stop smoking, so it's not a medication you're meant to be on for a year or two. It's measured on the order of weeks to months.
And it does seem like it is very effective, right? I mean, even though there are a lot of, like you said, important short-term side effects, that if people can make it through the course, it does seem to be very effective in getting people to stop smoking.
Absolutely, and I cannot stress the smoking cessation issue enough. I looked at a couple of randomized controlled trials that were published in JAMA from about 5-10 years ago, and it's significantly more efficacious than placebo, as well as than the best medication before, which is bupropion. So the adverse side effects which your listener may be concerned about are the potential for cardiovascular side effects. In some groups of patients, they noted an increase in major adverse cardiovascular side effects. But the issue with this is that, one, while it increased the relative risk, meaning that people who were on relative placebo had double the risk, the absolute risk was still less than 1%. And as far as decreasing potential for adverse cardiac events, it's the best thing to do is to stop smoking, because smoking exponentially increases all adverse cardiac events.
Yeah, so most of these issues that it causes seem to be symptomatic, and in other words, they're not. It doesn't appear, at least from what you're saying, that there are known long-term negative health effects of taking a course of Chantix.
Absolutely, and as I mentioned before, though, this is probably because Chantix is not meant to be a long-term medication.
Right.
So most doctors will more than likely cycle their patients off and then approach the strategy from a new session. Sometimes people just aren't ready to stop smoking. So Chantix is mainly for people who are ready to make that life decision.
All right, let's take a listen to a voicemail question that we got regarding Obamacare and veterans benefits. Take a listen to this.
Hi, my name's Erin from Seattle, and I have a question for Dr. Gonzalez. I'm actually a veteran, and the VA actually covers all of my health care costs. What does that mean for the Obamacare? Am I going to have to actually, pay the, tax on not actually receiving health care? Or do I actually have to go get health care that I don't need financially? What do I need to do? Thanks. Bye.
So this is a really interesting question because veterans benefits are a big thing. I've talked about on the show how I don't believe veterans are getting the best care that we can provide and that they deserve, along with every other American. So what is going to be the repercussion here?
So first, I'd like to thank the caller for their service to our nation. I really appreciate it. It allowed people who are in a similar age cohort to be able to do things like go to medical school instead. Secondly, to address the issue specifically, as far as the veterans benefit under the Affordable Care Act, the Affordable Care Act doesn't change your veterans benefits at all. So whatever you had before, you're not required to go out and get an additional form of insurance. The Affordable Care Act largely brings in people who did not have insurance into the fold, as well as mandates what minimum requirements insurance companies must supply. So if you were already covered under VA benefits, it's not going to change your benefits at all.
It seems like, broadly speaking, no matter what type of insurance you already have, if you already have some kind of insurance, whether it is through the VA or if in Massachusetts already has certain plans, or a private insurer or whatever the case may be, you aren't necessarily going to change much of your coverage based on Obamacare provisions becoming enacted.
Absolutely. So there are some programs under Obamacare which may change the delivery of healthcare. For instance, as we talked about before, the pay for performance programs or the accountable care organization initiatives. So that is more based on your insurance company and your hospital wanting to align themselves with quality initiatives. But as far as forcing you to see a doctor or getting unneeded procedures, Obamacare has not really done anything in that respect.
And the third question is from Sonia. She says, my sister gets fake nails done about once a week at a salon. She's been doing it for 20 or more years. She's had several medical conditions, and I've told her to stop the manicure, see if some of them get better. Some of her ailments have been hair loss, dizziness, heart palpitations, and uterine cancer. She's been cancer-free for about 7 years. I know there are many medicines that are given through the skin in patches, and the concern here is the products used in manicures, and really we could say a lot of the beauty products. What do we know about their effect on long-term health? I mean, a manicure a month for 20 years or a manicure a week for 20 years is certainly a lot if there is something in those products.
Yes, I do have to confess that as a general surgeon, this is not an issue I deal with a lot. The dermatologist may deal with this more, but in terms of addressing the idea of beauty care and as it interacts with healthcare,
right,
I would say, unfortunately, the healthcare establishment has not done a lot of investigation of these products. I know the dermatology organization has issued a kind of cautionary warning about this, but as far as like evidence-based medicine, can you PubMed or find an article in the journal looking at the impact of manicures on long-term health outcomes? I would say no. Regarding your sister's conditions and various ailments that she has, I would say that uterine cancer has not been linked to any healthcare or beauty care products that I know of, and certainly not with manicures. I appreciate your concern for your loved one, but I would say that getting the manicures probably are not impacting at least the symptoms that you've described. The concern for the manicure, especially with the liquid ones, is that apparently to harden that enamel that they put on, they use a UV light. And UV radiation is the same that's in the tanning beds and carries a risk of malignant changes as far as skin cancer. However, that is substantially less well regulated, so we really don't know like how much light is being applied, what's the radiation dosage, how long. The best thing to do would be to just not do it, because I'm not sure what job your sister's in, but I would imagine that manicures are not mandatory.
All right, so there it is, Sonia. Excellent questions. 3 broad-ranging questions here. We've been speaking with Dr. Andrew Gonzalez. He's a health services research fellow at the University of Michigan and a resident physician in general surgery at the University of Illinois Hospital and Health Sciences System. Great to talk to you. Thanks for answering these questions, and I'm sure we're going to get plenty more. That's for sure.
Appreciate your time and questions.